Now our journey begins here at Tan Tock Seng Hospital, and we'll be looking at therapy that you may not have heard of before.
Spa or retail?
Debbie. Occupational therapy is a healthcare profession concerned with helping disabled people perform everyday activities. Occupational therapists see patients who have physical, mental or emotional problems. Some of their patients may be dealing with old age, adapting to life after a stroke, or coping with the loss of a limb. Therapists use a variety of treatment methods to help patients function at work, care for themselves, and improve the quality of their lives. We're hiding in a mock-up apartment on the grounds of one of Singapore's largest occupational therapy centres, and we're waiting for our first therapist.
Hi Heidi.
Hi Debbie.
Hi Heidi.
Have you just come shopping?
Oh no, I brought you some things to show you what occupational therapy is about.
Great. Well, why don't you show us then?
Sure, let's go.
Yeah.
There's a non-slip mat, there's a adapted chopping board, and this is an adapted knife. So now I'm going to get my friend Patrick to show you how to use these assistive devices. So Patrick will be acting today as a person with who just had a stroke. One of the common presentations of stroke patients is the inability to control one side of their body. And the adapted knife allows him to be able to cut just with one hand. We're going to prepare cucumber and tomato soup today.
Perfect.
This mock-up apartment was created to give patients a realistic setting to practice new skills in.
This is called a long-handed reacher. So this is good for people who have difficulty bending over. Ding!
Wow, there's a mock-up car. What's that for?
Yeah, let me show you this car. This brake reaction time will test the reflex of a person's ability to press on the brake right after they see an emergency situation. We have patients who have stroke or even elderly patients, taxi drivers who are over the age of 70 and they want to return to driving, need to come for the test.
I bet I've got faster reactions than you, Jean.
You know what? Okay, you can get on it first, but let's settle it with a race.
Alright, let's do it. Michael Schumacher, eat your heart out.
When you see the green light, then you will press the accelerator.
Okay.
And immediately when you see the red light, you'll press on the brake as quickly as you can. Well done. Your response time is 0.53 seconds. That's pretty good.
Oh, alright. Watch me. Here I go.
So now press on the accelerator. Look up for the red light.
Alright.
Your response time is 0.65 seconds. So that means Debbie is quicker than you.
Give me the cup.
What is that? So Heidi, what do we have here now?
Oh, this is a simulated work setup. It's to help us to evaluate people sitting at the office workstation to see if they're practicing the correct postures.
I'm a little unsure as to whether I sit properly, because you know, as a DJ I actually work 4 hours a day sitting down.
Oh dear.
You want to check me out?
Oh yes. Why not?
This is how I kind of sit.
Right.
And I have my keyboard kind of here. Heidi looks at how I sit and tells me I'm doing everything wrong. She corrects the position of my keyboard, adjusts the level of my seat, and even gets me a backrest.
This will help you to support your back.
This is comfortable.
Here's a collection of splints that we actually make for our patients.
And who would actually be using these though?
People with hand injuries, either traumatic or repetitive strain injuries. Splints help to facilitate healing, reduce pain, and also help to correct deformity. So one of the activities that people may do is to SMS, and they will SMS too much and they might end up with a sore thumb. Okay.
What's the right way to sort of SMS?
For people who SMS a lot, we will ask them to use 2 thumbs so that they can alternately use their thumbs instead of just stressing on one thumb.
Right.
Otherwise, if you still continue to have pain when you SMS, then you might want to wear soft splint support like this to support the thumb and reduce pain when you're doing the SMS.
You're a big SMS, so you can try.
Okay, just like this. Okay. Oh, now you can try it on your handphone.
Okay.
All ready to speed SMS.
There she goes again.
Occupational therapist's breadth of practice is quite broad, so it also covers stress management. I'm going to teach you a very simple deep breathing relaxation exercise that will help you to relax your muscles and your mind. So get comfortable and let's try to do that.
Okay.
So you've got to put one hand on your stomach and one on your upper chest. Remember, only the lower hand is to move during this relaxation exercise. So you are breathing deeply into your lungs.
I feel stress-free already.
So do I. Heidi tells us this tour has only given us a few snapshots of what occupational therapy is. Heidi says occupational therapists also work with children and people with mental health problems. Well, thank you so much, Heidi, for your time today and for showing us around. We had a really good time.
My pleasure. I hope you enjoyed yourselves.
I must say I really enjoyed occupational therapy. I feel all relaxed now. And I'm taking this with me so I can SMS like a maniac.
Debbie, that's not the point, and I can't believe you're taking that with you.
Look, Heidi, 2 thumbs.